All right, hello, and welcome to this webinar. It's titled Building a Trans and Non-Binary Pipeline into Counseling Psychology, Creating Equitable and Just Environments from Admissions to Orientation and More. So thank you all for being here and welcome. So this webinar is hosted by the co-chairs of one of the special task groups from Division 17. So the STIG called Building a Pipeline for Trans and Non-Binary Graduate Students into Counseling Psychology. And this webinar is part of the 12 months of building a counseling psychology of liberation as part of the Annalise Singh's presidential initiative. So before we get started with introductions, I just wanted to orient everybody to the webinar. So you'll see at the bottom of your screen, there is a button for question and answers. And so you can feel free to ask questions throughout. We are hoping to get as many questions as possible. We do have some stuff prepared to speak to, but we also really want to make this interactive and as relevant to all of you as possible. So please, if we say anything and you want us to expand further, or if you have other questions, we'll be keeping track of those and we'll have some time at the end to address those questions. So some of you have also noticed that we also have a chat box function. So also at the bottom of your screen, there should be a chat box. So feel free throughout to type in there. We'll be able to see those chats, and we might also be putting some links and resources in that chat box for you all as we go forward. So my name's M. Matsuno. I use they, them pronouns, and I will be helping moderate the webinar, but I'll let the two other panelists introduce themselves first, and then I'll introduce myself. So Laura, do you want to start us off?
Sure, thank you, Em. Hi, everybody, and a special shout out to Michiko, who I think is logging into this call all the way from Japan. Awesome to have you here. And not that other people aren't awesome to have here, but I just think it's cool we have somebody from a different country. My name's Laura Dickey. I'm a behavioral health consultant at an organization called North Country Healthcare, which is a federally qualified health center in northern Arizona. We have primary care clinics from the Nevada to the New Mexico state line and from the Grand Canyon all the way down to Payson, Arizona. So I'm embedded in a primary care setting, and we have integrated behavioral health. Prior to my work here, I was in academia, and yeah, I'm just super happy to be here. For those of you who don't know me, I'm also a trans-identified person. I use he, him, his pronouns, and I'm gonna toss it off to Steph.
Thanks, Laura. I'm Stephanie Budge, she, her, hers. I'm an associate professor in counseling psychology at the University of Wisconsin-Madison. I'm also the director of the Trans Research Lab here, and I have a couple of other roles. I am a health psychologist at the American Family and Children's Hospital, and I work with trans kids through the Pediatric and Adolescent Trans Health Clinic there. And I'm cis and queer identified, and consider myself an accomplice in the trans community. I'm happy to answer any other questions as we chat more.
Awesome, thank you. And so I'll introduce myself. My name's M. Matsuno. I use they, them pronouns. I'm currently a postdoctoral fellow at Palo Alto University, working with Dr. Kimberly Balsam. And in my postdoc, I mostly do research, but I also do a little bit of clinical work. And my main focus in both of those areas is supporting trans and non-binary folks, doing some research on minority stress, specifically with non-binary populations, and also resilience. And so I'll talk a little bit about my interest in this topic and in being in this STIG. And then if you all want to add anything about kind of what brings you to this topic. So for me, so I was recently a graduate student, so I'm hoping that I can kind of speak from that perspective. But just throughout my time in graduate school, I met a lot of other trans and non-binary graduate students and started like building a community. And then as part of some of my committee work, we decided to host a webinar with 5 panelists of non-binary graduate students, which I just thought was so incredible. So we did that webinar last May. And we got such a great response, like so many audience members, so many people wanting to learn more about that. And one of the coolest parts of that webinar was just how validated the panelists felt, and that there was a lot of other trans and non-binary graduate students like reaching out by email saying, wow, like this helped me feel less isolated. And so then, you know, I just really tapped into like this advocacy for trans and non-binary graduate students. So then that kind of led to this idea of like, we need to connect with each other, like we're out here. So that led to me creating these 2 Facebook groups. So one is for students only, trans and non-binary students in psychology, graduate students, and now open to undergrads who are looking to go to graduate school. And so it's really amazing. The group has like 120 members or more, all introducing themselves from all over the country. It just was so inspiring to me to build that network. And then the second Facebook group was for like around mentorship, so that trans and non-binary graduate students can get connected to those in the field and professionals and have some mentoring conversations. So anyways, that was just really meaningful work and just so fast. Like there's so much, I think, need around this topic. So I've been doing some research and just a lot more work on supporting and doing advocacy for this population. So I'm really excited about what our STIG is doing so far. But anyways, that's kind of my journey to being here. Is there anything else you wanted to add, Laura or Steph? Okay. So maybe one thing we wanted to do is just kind of share a little bit about what our special task group has been doing. And so if Laura, you want to kind of give an overview, and then we can add on anything else. So.
Thanks, Em. Annalise and I have been talking about this STIG for quite a few years. And I think one of the biggest places that we're focusing on is how to make counseling psychology specifically more welcoming to transgender, non-binary people. You know, I know that when I walked in to the doors of Division 17 in graduate school and such, there was nobody doing anything. And that's not just in 17, that was in the field as a whole. At least that's what it felt like to me. And so we're really interested in, you know, what are the ways that we're still as a field putting up barriers that make it hard for trans and non-binary people to not only feel safe doing the work that they do in training, but also feel like they have a professional home in Division 17. So we've got a couple of different presentations that the STIG has proposed for the Counseling Psych Conference in New Orleans in April. And then we had 2 or 3, I think, proposals that went out for APA convention next August in Washington, D.C. And I believe those were all approved, which is totally awesome. We're also working on a series of either webinars or kind of YouTube videos that cover topics like, why do I need to take the GRE? Why is this important? How do I prepare my application for graduate school? Do I talk about the fact that I'm trans? All kinds of great topics like that that's going to end up with a little compendium, if you will, of resources that people can access in perpetuity, because we'll put them out on the internet, and of course that stuff stays there forever. So that's kind of what we're up to. The STIG meets on a monthly basis on Zoom call, and I can't even tell you how awesome it is to have, we must have more than 16 people in the STIG, and when everybody's there at the same time, it takes 2 pages of Zoom for us to see all the faces, and that just warms my heart every time we all come together. I'm just like, I am so grateful that we're able to create a space today. Yeah, it's so different than it was 10 years ago, 2 years ago, last year. So thank you all for what you're doing that makes our work relevant.
Yeah, I agree. It's just so heartwarming to see so many people interested in this topic, especially within the field of counseling psychology. Yeah, and in addition to the YouTube series, something that we're doing with a collaboration with some of our members is a research study where we'll be doing interviews with trans and non-binary graduate students in counseling psych programs. So it'll be very specific to counseling psych. Very excited. We've got a lot of responses of people interested in doing interviews with us. And a lot of the people leading or doing the interviews and leading this project are also trans and non-binary graduate students. So really, really cool. And we'll be doing interviews in the next month, and I'll be speaking to some of the results of that qualitative study at the Counseling Psych Conference. And then something we hope to do from that research is to actually come up with some more handouts and guidelines for both what like faculty and supervisors and programs can do to be supportive, but also maybe like a guideline or some guide for trans and non-binary students to how to navigate these issues and challenges that come up. So I think that's another thing that we're doing I'm pretty excited about. Anything else?
Yeah, I would say that the final thing that we're working on is one of the next agenda items that we want to discuss is trans and non-binary curriculum for courses that are being taught across the country. So a couple of the members in the group have taught classes specifically focused on trans and non-binary people. And so we're trying to have a discussion about getting examples of the syllabus and how can we provide that information to more folks so that it's widely available.
Awesome. Yeah, and one of the sessions that we're doing at the Counseling Psych Conference is also about how to better build curriculum. So it's very exciting. Okay, so basically what we have structured is that we have some questions that we're prepared to answer, kind of going through like identifying what some of the challenges are that come up, and I'll be speaking to a lot of those challenges and then some different ways to address those challenges. And then again, we'll have some time at the end to answer any of your questions. And so we're going to start with talking about just from like applying and getting into graduate school, from that all the way through some of the challenges in graduate school. So just to kind of talk about what some of the common challenges that trans and non-binary students might have in the application process. I think number one is just trying to figure out if the program is trans affirming or not. So just in my personal experience, I was not out as non-binary when I was applying, and that's something that kind of I was exploring later in graduate school, but definitely trying to find a program that was LGBTQ affirming was like big priority for me. And so you're going through all these applications and there's so much information to just even find like what is a good fit, who is a good advisor, all these different things, but then to try to figure out like, am I really going to be safe? Would it be safe enough for me to be out in this program? And then also thinking like, okay, you're thinking about your advisor, then you're thinking about the program and faculty, then you might be thinking about the campus environment, and then you might be thinking about the local environment. So I think a lot of times students have to like kind of weigh and pick and choose like, well, maybe I can find a really affirming advisor, but it's going to be in a local community that might not have any trans resources. So there's like a lot of different pieces that I think folks have to kind of be evaluating and looking for. And sometimes when that material is not indicated or visible, then it's really hard to know like what is my experience actually going to be like when I go to this program. And then I think along with that, whether thinking about your application materials, whether or not to be out or disclose a trans or non-binary identity in maybe your personal statement. For folks who use they them pronouns, like that in itself can be a disclosure. And so, when thinking about letters of recommendation, like, do I want to use these pronouns or not? And it can be really tough because sometimes maybe you want to use it in some cases and not in others. But it can be really hard to say, well, maybe this is the program I really want to go to, and I don't know if this will be a setback or if people will read these pronouns and be turned off by that. But then if I go to this program, using different pronouns, like how will that be if I want to come out later on? So it's just a lot of those things to navigate. And sometimes letter writers also have opinions of like, you shouldn't be writing those pronouns, and that can also be hard, of like having that power taken away from you to decide what you want to do. So that's kind of like an overview of some of the things that come up. Any other thoughts that you all have? Does that cover? Okay, so then I guess
Just one thing quickly, Em.
Mhm.
Some people may need to navigate having diplomas in different names.
Right.
And I know for me, there's one university that has said, we can change your name on your diploma. I'm like, well, no, that's not who earned that degree. Then it's my responsibility to make sure that the folks in the admissions office realize that these are the same people.
Yeah.
But also, even though I did that pretty well, I thought, when I applied to school in 2004, they had me coded as female in the PeopleSoft system. So I had to go through a whole process to get that updated and corrected in my mind.
Mm-hmm. Yeah, that brings up a good point. Just like on the application materials, also if gender is like in a binary way, and then that can feel like, okay, what do I pick and how am I going to be coded? And then when they ask for the applicant name, if it doesn't specify whether they need your legal name or not, and there's not those like separate lines for your name versus your legal name, then it can be hard to say, okay, well, should I put my legal name because they might need that for like background checks? But then if I put my legal name, are they going to call me by that? And that's not how I want to be referred to. So if there's not like space for those options, then that can be really challenging too. Yeah. All right. So Stephanie, you're working in some admission processes. So you might have some information about just what programs can do to make the application process more inclusive and support trans and non-binary students who are applying to graduate programs. So if you want to speak to that.
Mm-hmm. Yeah, so I'm the PhD admissions chair in our program. So I have a few pieces that I think would be helpful from an administrative point of view. One piece that I think is an issue off the bat that often programs feel like they don't have any control over is whether or not students on the graduate school application have to indicate a binary gender option. And so here at UW, what we've been doing, this is a problem for our graduate school, which is that they only offer 2 options, and then that's it. And that's all that's included in terms of gender on the application. And it's a university-wide thing, so we don't have any control over this in our program. But one thing that I did related to this was that I joined our university's LGBT committee. Some folks don't have that. If you don't, then maybe my first suggestion is to create one. But we already had one at the university. And so part of what we've been working on is an option for how to actually communicate that to folks when they're applying. So it's a federal mandate to actually ask that question in that way. So also the universities don't have any control over that. But what we're doing in our school is that we're actually indicating that to people. This is a federal requirement that we have to ask this question. Please indicate the option that you want selected at the university level. And then we have our own questions that we include regarding gender. So we actually tell people we have it be a transparent process. so that people know that we've been thoughtful about it, because we don't have any control over that process. And so I use this as an example because I think what happens a lot of the time is people say, well, this is a terrible option, or this is something that is really invalidating to people, but we don't have any control over it, so there's nothing that we can do. And I think in this, it's not the best solution, but I do think that it's one that at least is lending toward a thought process about us trying to be thoughtful about how to navigate that while we have federal mandates. So that's one example that I have. The other piece that I think is really important is we've been trying to communicate to folks we have like a PhD admissions kind of process where people can show up or ask questions about our program. And we talk to people about the GRE not being, and grades not being, the primary things that we look at in our program. And I would suggest that other programs follow suit, especially given the evidence that we've seen lately about predictive validity of the GRE and grad school performance. But I say that because I think a lot of the folks who I've mentored and worked with have come out in college, and during that time it's really impacted their grades or impacted some other pieces of academic performance. And so one of the things that we try to make clear for us is that we really try to make sure we're looking at the whole person and their application, rather than just those scores or those components. And that perhaps if that's something, if you do decide that you want to be out in your application, that's something that maybe you would want to talk about and speak to, or have letter writers talk about your overall performance and some things that, and that maybe those semesters or pieces were not indicative of overall ability. The other piece is that I think having information on your website that indicates the trans-affirming nature of the program, I feel like we have a lot of room to grow in our program related to this. I think one thing that is helpful is that we do have specific websites that talk about the trans-focused research and advocacy that we're doing that are based in the Trans Research Lab piece. But I think that in addition to any type of research or work that's going on, having links and resources that are available to different pieces on campus that are available to trans students. So for example, we have a whole trans healthcare team as part of our university health services. And so having links to those kinds of pieces to show that it's not just the program that's affirming or supportive, but if there are other pieces on campus or in the area that could be helpful, that would also show potential applicants of the affirming nature of the program. The last piece is hiring trans and non-binary faculty and staff in programs and having representation. So I'll leave it there. I can offer more advice about that if people have questions about it, but I think that's self-explanatory.
Awesome. Thanks so much. I think those are really, really great suggestions, and I like that you address some of the workarounds. Like when there are barriers, you don't just have to like give up. Like there's ways that you can just be transparent about like, hey, this is where we're at, but this is like showing that intention, I think goes a long, long way. So I really appreciate that. Okay, and so if you have any other questions about like the admin process or for helping, recruit students, please like leave some questions in the comments and we can come back to this. But next we wanted to move forward to just talk about, once you have trans and non-binary students in your program, how can you support them? Because that will also create more people wanting to come to the program and create more people, graduate students becoming professionals in the field. So I just wanted to speak to some of the challenges that, some common challenges that trans and non-binary students face in their programs. And there's a lot of different ones, so I might kind of give an overview. So if you want me to expand on anything, again, please just leave a comment. But I guess first I'll just say that graduate school is very difficult and there's lots of stressors. It's a high pressure situation just for everybody, but there's just a lot of extra layers of stress and the minority stress that trans and non-binary people have to go through and navigate. And so, just binary systems and navigating that can be really difficult just on campus in terms of bathrooms. That's a daily stressor of like, okay, which bathroom do I use? Am I going to be safe in the bathrooms? Bathrooms are just so important because we need to use them every day. And then if we do have to compromise and use a bathroom that doesn't fit our gender identity, and then people are seeing us in that bathroom, then that can lead to more misgendering. And anyway, so that's definitely a big stressor and something on a systematic level that people, I think, can work towards changing. And then some other ways that there's kind of like binary reinforcements in programs. So for one example, it's just kind of professionalism and professional attire. And yeah, I was just having an interesting conversation about like what is professionalism, and there's so many different ways that professionalism can be used to uh, just not include all different cultural representation, and it can have a lot of different elements of biases and oppression in multiple ways. But I think in terms of for trans and non-binary students, it can be a very like, even if you look at like what's expected, it can be in a very binary way. This is how men dress, this is how women dress. Sometimes it explicitly says that. Sometimes there's explicit rules about what you need to wear. And that can be very, very extremely stressful. And so, or even if there's not that explicit, there's kind of like an implicit of like, well, you have to wear these certain things. So for folks who want to wear like a combination of different pieces of masculine or feminine attire, then that can be difficult to navigate. So I think that's can be another big stressor for folks in terms of those binary systems. Okay, so speeding through this, just another like system level stressor can just be healthcare, and going through like a lot of trans and non-binary folks might be using therapy or be going to the university healthcare center, and for folks who are going through different transition processes might be doing hormone therapy or getting ready for surgery and other things like that. So if the student health insurance doesn't cover those things, it can be a really big financial burden. There's a lot of trans and non-binary folks who are not supported financially by their families of origin. So there can be a lot of financial stressors and things going on like medically and mentally that can be happening while you're also trying to get through your graduate program. So I think those are kind of system level things for the university that can be addressed. But I guess just kind of on an individual level, a lot of what I've heard of some different stressors that people experience, I think one is just feeling really isolated or feeling like you're the only one. Maybe you are the only one, or that you kind of stand out, and that everybody might just see you for that identity and not for you as your whole person, or not being able to find that community support. I know for myself at our university, there's a lot of support systems for undergrads, trans and non-binary undergrad students, but there's not as much support for graduate students. So that can be really challenging. So I think finding ways to build those community supports. And then, yeah, I guess sometimes there's like a couple different ways, stressors, like on one side, there's can be just very, very unaffirming environments and kind of intentionally harassing environments and things like that. And I think that on the other end, there can be a lot of well-meaning people and programs that can maybe unintentionally tokenize trans and non-binary students. So there's like a sense of like, oh, we really value as a trans person, but then it can kind of cross this line as like, okay, like now you're the trans person, so we really need you to like educate us because we want to be educated, which is great intention. But there can be, I think, some assumptions that trans and non-binary folks like want to be doing all of the education, or like want to specialize in these issues, or it's their responsibility to speak up about issues as well. And that's just can be a huge burden to put it all on like that one person student to address all of the issues kind of on their own, or feel like that's being put on them without their consent, I guess. So yeah, I think that's kind of like one way of tokenizing. Yeah, I've talked to a lot of trans and non-binary students where maybe as soon as they come out, there's like, oh, okay, so can you do this? And can you help us like look over this materials? And can you review this manuscript for me? And can you also like review my curriculum? And it's just a lot of work that's maybe not acknowledged or like adequately compensated. And so I think, that's just one way that looks. In a clinical context, also, I think there's a lot of assumptions that, oh, you must want to specialize in working with trans clients. And so then a lot of people get really burnt out because they're given so many trans clients and that they might be high risk. And then they're feeling really responsible for like supporting all of the trans clients of this community, of this one agency, and not really having people check in with like, is that part of your training goal? Is this something that you're wanting to do? So I think that's just one major thing. And then another thing is just kind of those microaggressions of being misgendered or feeling invalidated or maybe feeling invisible. A lot of times when we, in diversity classes, maybe trans and non-binary issues aren't even addressed or brought up, or just thinking back to some of my classes in other areas like research methods or statistics, every example is like gender is a binary variable and like men do this, women do this. So like little things like that can just be really hard to experience. And then there can be a lot of burden of like, okay, if we see these problems, then it's often put on the trans and non-binary students to bring it up, to say something and to advocate for that. So that can also be challenging. So I know that was kind of a lot of different areas. I'm happy to speak to more and more specifics, but I think those are just some of the highlights of the main things that I've heard and experienced. So anything to add that I might be missing from or Steph? Okay. Great. So maybe we can talk to some of the ways that, faculty, staff, other students can help with these challenges.
Thanks, Em. And in fact, I'm going to try to address the two questions that we've had so far in this next section. Becca was concerned, how can students encourage, insist that trans and non-binary issues are integrated in their training, where in many cases it's not happening at all. Like the only training you get on transgender issues is in your behavior pathology class, where you discuss the DSM and the fact that gender dysphoria is still in the DSM. I'm happy to say that may be changing very soon. That's just a little teaser for you. So, the hard part for the student, and I was certainly in this place when I was a student, was when I wanted to see other things addressed, I was responsible for bringing that up, or I was responsible for making time to meet with my professor to try to understand how that might be integrated. I remember the first year evaluation that I received said that I had met too many times with my advisor. Well, I was required to meet with my advisor weekly because I was leading a support group. Okay, I'm supposed to get supervision for the clinical work I do, so I'm going to meet with you weekly, and then I'm going to get in trouble later for actually doing that? There's a problem with that. So I think of concentric circles, right? When we talk about doing a lit review, we want the stuff that's very focused on our topic. And then if we don't have that, then we go out to the next layer and the next layer and the next layer. We can do that same thing with the kinds of support that trans people need in order to be able to get things done in their programs so that they feel like they're leaving that program with the training that they need to do the work that they want to be doing professionally. So are there LGBT plus people in the program that the trans student can reach out to? If there aren't LGBT plus people in the program, is there an LGBTQ student group at the university? If there isn't a student group at the university, is that something you want to even think about taking on? Understanding that it's going to take away from the time that you have to do work that's required for your classroom expectations. So, wherever you can find those sources of support are important. And, if you know that there are people somewhere else outside of your university who are doing that kind of good work, getting the support from them as well in how to gently encourage your program to do the good work that you expect to have happen. The second question was about how to support trans non-binary students who come out, who disclose their identity and their pronouns, and how, as faculty members, can you be there to not only just witness what their experience is, but also then turn that witness into action. So if it's appropriate, and it's not that you want to take the power away from the student around coming out, but it may be empowering to have an ally who can help with that process. Now, I am always super cautious about telling people that it's their responsibility to come out on anybody else's behalf, because it's not. In fact, that can be really problematic. So making sure that the student actually needs that kind of support before you jump in. And, I appreciate people are ready and to be supportive of students in this way, but we have to be careful how we do that so that we aren't outing the student in places that they are not ready to be outed in. In terms of clinical work, one of the things that really stresses me out is when I hear any trainee saying, I've stopped telling my supervisor when I have a client who's trans, because then everything becomes about that client being trans and what's pathological about that. Like, have you talked to them about their relationship with their mother? Because surely that's the reason why they're trans, right? Or, did they have a traumatic experience? That's the reason why they're trans, which is not necessarily the case. So knowing that oftentimes the student may have more information about trans and non-binary people than the supervisor does, in the same ways that we don't expect our clients to train us on all that information, we shouldn't, as trainers and supervisors, expect our students to do all that training either. And there are a ton of really good resources, and one of them I'm going to put in the chat box now is a book that Annalise Singh, oops, I just sent that to panelists. Here we go again. A book that Annalise Singh, San Chang, and I wrote that was published a couple years ago. I can't believe I'm already saying a couple years ago. But it really is a very, I would say, extensive and exhaustive book around how to work with trans people, with lots of wonderful examples and questions for the counselor and questions for the client in each of the chapters. And so I encourage you, if this is the kind of work that your students are going to be doing, to get and read this book. If you don't have or haven't read the APA trans guidelines, I also encourage you to do that. The nice thing about the guidelines is they're free. Who doesn't like free, right? And the guidelines will be sunsetting in a couple of years, but I think Division 44 is somewhere in the process of getting the review of those started. And if not, they better be, because it's going to come up pretty darn quickly. And then as an extension to the trans guidelines, Annalise Singh and I co-edited a book that was published by APA. This book kind of extends the guidelines. It says the things that APA wouldn't let us say in the guidelines. So I love that Steph introduced herself as an accomplice. These are the ways we were doing some kind of making some really important statements to us that we hadn't been allowed to do in a previous version of something that APA published. So, and then APAGS has had an LGBTQ mentoring program. I believe they still have that. So if you can get engaged in that, if you're willing to mentor somebody, or if you're a student or a recent grad and you need some mentorship, I encourage you to, I see that M has just posted some information from APAGS that hopefully would be useful to you folks to get involved in that program. It's a great way to just provide people a little bit of support.
Yeah.
And then to recognize that we can't do this work by ourselves. We really can't be alone in what we do. And, you know, the relationship, for example, that I've had with Stephanie for, I don't know how many years now, a bunch, you know, has made a real big difference to me, even though, as Steph says, she's a cisgender, queer, identified woman. She has been as much a support to me in the last 5 to 10 years that has made a real difference for me in my ability to get up every day and put my clothes on and come to work and do what I do. So don't be alone don't try to do this by yourself. It's probably a great way to make sure that you don't get done what you intend to accomplish. So
Thanks.
with that, I'm going to toss it back to Em.
Thank you, Laura. Those are really, really great resources. All of those books I highly, highly recommend. And the Clinician's Guide to Gender Affirming Care is great because it also talks about, as clinicians who are trans and non-binary, some of the issues that come up. And I feel like that is so rare to see that, right? It's always assumed the client is that. So when you're actually helping your trans and non-binary supervisees navigate their role as a therapist with those identities. So that book has a lot of great info on that. Yeah, and I think I loved what you said, Laura, about like just checking in with students how they want you to advocate for them. Like there's different ways to advocate, and that might be stepping up and correcting others. That might be stepping back and letting the folks take the lead on that. So I would just really recommend checking in, following the student's lead. I just want to highlight that there are a lot of, I guess, emotional or other, like a lot of risks in being the one to correct others, to bring up that there's problems. I feel like sometimes when I see all these things, I'm like, oh, I don't want to be like the squeaky wheel. I don't know if that's the right expression, but you know, like there's could be some backlash of like, wow, this person's always like correcting us, or like maybe some emotional distancing. And so it's hard. There's those risks too. And then when you're correcting people in power, sometimes people can take offense to that or not be open to that feedback. So I think it's another really important way that allies can step up and check in and say, hey, I noticed this happen. Is it okay if I speak to that person and let them know? And I think that can be really empowering. But okay, so I know we have a lot of other things that we're ready to talk about. So maybe we can move along. I know, Stephanie, if you wanted to just add anything about like what programs can do to address some of those systematic barriers that I touched on, or anything else that we left out in terms of ways that faculty can support trans and non-binary students.
Yeah, thank you. And I will probably just highlight a couple of pieces here given the time. And also Michelle asked a question that I can answer in this as well. So a few things that I wanted to say that I think are important is that I think faculty and staff need to make sure that they're up to date on the training and on the same page. One thing that we did last year as a faculty is we set aside a half day for us as a group to be able to talk about all these issues that Em brought up, and to say, how do we want to collectively decide as a group how to handle situations or how to have conversations about this, and how do we want to correct each other and have a culture around that correction so that it doesn't feel like it's always on the students or on the trans and non-binary people to be doing that. So just to kind of share that that was an exercise that we went through as a faculty, and I feel like it's been really helpful just to be able to model for each other if somebody does mess up quickly, you know, to be that we have a simple process of just being like, oh, they, you know, and part of it is like try not to make a big deal about it unless it's something that is like that the person's not trying, and then that's a different issue, right? But I think part of it is like really having a conversation about how as a department we want to have that kind of a culture, and having all the faculty and staff on the same page is really important. Also paying trans and non-binary psychologists to consult with the department about inclusivity. I think really making sure that you're, you know, paying folks for their time. We talked about the labor of educating others and being tokenized. And that one way of not having that happen is that trans and non-binary people who are consultants who put this out there as part of their educational practice, that you can pay them and bring them to campus to do these trainings. So I feel like, you know, so part of the pieces that I would talk a little bit more about are how to talk about attire and how to make sure all gender bathrooms are available, but we don't have a lot of time to talk about that today. So, you know, that might be something that we talk a little bit more about in the future that you can talk to us about as a group later. I would say also at faculty in counseling psych programs and other clinically oriented programs have to screen all prac sites and supervisors to make sure that those prac sites are affirming before you send trans and non-binary students their way, because you know, part of what happens is that you'll hear about really negative experiences around misgendering or transphobia later on, and then those students are kind of stuck at that site or feel like they don't have any other options after the fact. And so you should do that work ahead of time. And again, if you have questions about how to do that, we can maybe have some more time after this to talk about that process. Also provide a list of healthcare options to students. So we have a whole therapy referral list for all students, and we can provide specific recommendations based on insurance and identity matching and competence. So that's something that we provide to students in our department. I would recommend every department have something like that. And then also the final thing that I wanted to mention is that department should have really specific and clear grievance policies and situations where TNB students are experiencing invalidation or microaggressions, and really have that be a clear process that students can go through. If any of these other things that we've talked about haven't been, you know, able to be alleviated for students. So those are just a couple pieces that it'd be hours more to talk more about how to do that, but at least kind of thinking about, do you have these procedures in place? And if you don't, thinking about how you can get to that space. The last thing I want to talk about is that Michelle's question was about what do you do in other faculty, you know, minimize minority stress or invalidate students. And that's, I guess, I just wanted to say, I feel like if you have this initial conversation where you really say, like, how do we want to have a culture about doing this with each other, then it will be easier for you to actually challenge those faculty members, because you can refer back to that conversation that you had. Like, remember when we had that conversation as a group about how we want to support our students? This experience right now, what you're sharing with me, doesn't feel like it fits with that, you know, this agreement that we had. So I feel like it's helpful if you kind of have clear guidelines or rules around how you want to do this, because it's easier to kind of refer back to that. And I guess the other piece that I would say is, depending on the power dynamic, you know, I think you can gently you know, share with somebody. That doesn't sound like that's a really supportive thing to say if, you know, you're minimizing their minority stress experience. And so, you know, it's probably more of an interpersonal issue at that point if they don't respond well to that intervention. And we could talk more about that if people have more questions. So.
Thanks, Stephanie. I really appreciate that. And I think there can be like build a culture of like, we're all in this. Like if people do have that intention of like, hey, like we're helping each other, remind each other about like, oh yeah, wait, it's this pronoun versus like, gotcha, you know, you're terrible. And then people get really defensive, but like, no, like we're all committed to helping each other. And I think when students see that there's that effort going on, then that goes a long way too. So we, you know, it takes time to relearn, but I think committing to that. And when you show that, then that goes a long way. Yeah, and so I just wanted to address a few things that might be relevant for clinical supervisors and also faculty mentors and those relationships with trans students, and how we can support trans and non-binary students in that sense. So just to briefly cover some of the challenges that come up for students in practicum sites or in clinical settings. I think one thing can be a lot of anxiety around disclosing their trans identity or disclosing pronouns with clients. And I think, for folks who use they, them pronouns, it is an interesting thing because now, pronouns don't equal an identity, but a lot of times it is a disclosure because people will assume, oh, okay, if you use these pronouns, then this is your identity. And it can be really stressful when you see all these new clients every day, and then every interaction you're kind of have that high alert of well, now I just came out, and is this person going to accept me? And you're starting this new client relationship. And anyways, so it can just be really anxiety provoking, and depending on where someone's at and their comfort with sharing that openly with everyone, or if a lot of trans students code switch and say, okay, I'm out, I want my colleagues to use these pronouns, but for other folks I go with these pronouns. So I think that for supervisors, just understanding that there's no right or wrong way to do that, and just helping students negotiate what feels safe to them, what feels authentic to them, and kind of working through that. Just for me personally, I had my pronouns up behind me, but I didn't have to say that my pronouns each time, and that helped me feel congruent in that I'm being myself, but I'm not necessarily having to have that interaction every time. So that's just one thing that might come up in supervision. I think another thing is just making sure that the front desk staff is trained, as well as everybody, because a lot of times in clinical settings there is a matching process, and a lot of folks a lot of clients will request working with a woman or working with a man, or different races and ethnicities as well. And there's a lot of assumptions that happen of oh, yep, we have a person for you. And so then that can also lead to misgendering. And it can be a really, really hard situation when you're oh, I see on the note that I was matched based on this gender. That's actually incorrect. And now how do I address this with the client? And that's really stressful. So something really important to keep in mind. And then I think what Laura mentioned, if supervisors are making inappropriate comments about other trans clients, or misgendering other trans clients, or pathologizing them, then that can just feel really unsafe for the trans student in that supervision group. And then that can just really impede their willingness to bring those things forward. And that really interrupts their training experience. And just, I guess, for supervisors and advisors, recognizing that there is that power differential can make it really hard for students just to bring those things up on their own. So those are just some of the things I've noticed in clinical work. So maybe, Lord, if you want to just add on to anything about what supervisors can do, and then Steph as well.
Yeah, not unlike the question that has been asked us about how we think the DSM-5 is with regard to diagnostic issues. I have a love-hate relationship with the DSM. You can probably see a pink thing over my head here. This came from a protest that I helped organize in 2009 when the American Psychiatric Association was was making decisions about who was going to be on the work group that would make changes to gender identity disorder from the DSM-4 TR to the DSM-5. And even though the name of the illness has changed, and even though in the ICD-10 or ICD-11 moving forward, it will not be considered a mental health disorder, it's still a diagnosis. And the diagnostic criteria did not change between 4 and 5. The kids are still expected to enjoy rough and tumble play if they're a boy, and all this ridiculous stuff that, while it's important to know what that is and to know when a person might actually need a diagnosis, and when they don't need a diagnosis, and to talk with your supervisees and clients, depending on which role you're in, about when a diagnosis might be necessary and how they feel about that, giving the client and the supervisee some agency and autonomy. I read about that somewhere in the ethics code, that people get autonomy. It just to be so careful about assumptions that we're making. We hear somebody's trans and we automatically think, oh, they want all of these hormones and all this surgery, and that's not an accurate assumption to make about any trans person. I could have, the same I might use the same identity words to describe myself as another person, but that doesn't mean we're going to take the same road, if you will, toward transition, whatever that means for us.
Thank you. I think that addresses a lot of the stuff with some of the assumptions with the DSM and that whole work. And then I guess, Stephanie, if you want to just talk a little bit about I know you do a lot of mentorship and supervision with trans and non-binary students, and just any advice that you have for other supervisors and for supervisors who also identify as cisgender, like how they can be supportive.
Yeah, I mean, I think that the main thing is that you have to be prepared to be an advocate. And that means a lot of things. It means, what I mentioned before is, having to actually challenge people when they invalidate trans and non-binary trainees, or anybody else who's around. And so I think part of it is you can't really be a supervisor and not be willing to speak up. And some of that advocacy isn't just speaking up, but it's, really actually taking the time and space to making sure that the whole institution is supportive. What are the forms like? What does a website look like? What are you paying attention to in the supervision that's happening? So I think sometimes we think of advocacy as, what a very minor, kind of a small lens, but that it has to be throughout the entire individual, contextual and institutional level. I think other than that, I feel like the other piece is having conversations with trainees, with trans and non-binary trainees, about power and what they need. And this has already come up, and so I'm not going to spend too much time about this, but I do think that, really making sure that you're not making assumptions about what they need out of their training, or how they want to be addressed or how they want to talk about things. And so I would say actually explicitly addressing power in those conversations, what that looks like between the two of you and what that looks like for other people in power, that conversation at the outset can really set the tone for what the supervision relationship can look like.
Totally. I really appreciate that. Yeah, I think with supervisors that I've had that have been really affirming, it's that they actually explicitly talk about the power and say, I'm open to feedback, and continually check in for feedback. And then when feedback does happen, to be open and say, oh, thank you, rather than, oh, sorry, it's all my fault. And then, kind of, then it creates a whole thing of oh, I shouldn't have brought this up, and now I'm just complicating things. So I think those are some things that have really gone a long way, to just go with some examples. So I know we have to wrap up. We just have a couple more minutes. Any final pieces of advice or any other resources that we want to mention before we sign off for today? Okay, awesome. So yeah, if we didn't answer any of your questions, please feel free to reach out to us by email. So this recording of this webinar will go up on the SCP website, along with the other videos for all of the other great webinars from this series. We will all be at the Counseling Psychology Conference in April. We would love to meet people and talk to people then and share more about what we're doing. Anyways, we really, really appreciate you all being here. And yeah, thanks so much. All right. Take care and have a good day, everybody.
Thank you, everyone.